Ready
Yeah.
to start?
Yeah.
Okay. You get called to a mid-30s female who's been shot in the upper right chest.
Alright, so BSI is my scene safe.
Yes.
Alright, so nature of illness is a gunshot wound to the upper right chest. Is this my only patient?
Yes.
I'm going to call for additional EMS resources, and I'm going to have my partner maintain stabilization of the C-spine. So walking up, my general impression of the patient is an unstable patient. I'm going to assess for alertness. Ma'am, are you okay?
Patient's unresponsive.
Alright, so I am going to expose the patient, look for any massive hemorrhaging.
Okay. And when you do that, you expose the chest and you see blood spurting from the chest.
Alright, so I'm going to apply an occlusive dressing to the upper right chest.
Bleeding is controlled.
Alright, so next I'm going to move on to the airway. I'm going to inspect the airway.
Airway's clear.
Alright, so I'm going to assess for breathing and circulation.
Breathing is inadequate.
Alright, so at this time I'm going to insert an OPA and have my partner attach a BVM to high flow oxygen, 15 liters a minute, just enough to see chest rise every 5 to 6 seconds. I'm going to move back to circulation, assessing radial and carotid pulse.
Radial is weak. Carotid is good.
Alright, and then I'm going to assess skin color condition.
Pale, cool, and clammy.
Alright, so I'm going to throw a blanket on my patient to help with hypothermia, and then I'm going to inspect the head for any trauma.
No head. No trauma to the head noted.
Alright, I'm going to declare this patient high priority transport. Do I have a sample history or anybody that can give me?
Nobody can give you sample history.
Alright, and then I'm going to assess vitals right now.
Blood pressure 82/60, pulse of 94, and respirations of 12.
Alright, so I'm going to start with my secondary assessment. I'm going to inspect the back of the head for any crepitus or anything like that.
Nothing noted.
I'm going to inspect the facial bones.
Facial bones are stable and intact.
I'm going to inspect the eyes for pearl.
Eyes are pearl but sluggish.
Alright, I'm going to inspect the mouth again and the nasal airway.
Good.
Alright, I'm going to inspect the neck, look for JVD or tracheal deviation.
No JVD. Trachea is midline.
Alright, any step-ups on the back of the neck?
No step offs.
Alright, I'm going to have my partner attach a C-collar at this time.
C collar is measured and applied.
Alright, I'm going to check the clavicle.
Clavicle stable.
Alright, rib cage stable.
Ribs are stable.
Alright, I'm gonna listen to all sides, or left lung sounds,
Present.
upper, lower,
Present.
right lung sounds, upper, lower.
Present.
Alright, I'm gonna palpate the abdomen in all 4 quadrants.
Abdomen is tender, non-rigid in all 4 quadrants.
Alright, if it was a male patient, I check for priapism. Female patient, I'm going to check for any bleeding or incontinence.
Nothing noted.
Alright, I'm gonna go down the patient's right leg, checking for any breaks or any trauma.
Nothing noted.
Alright, I'm gonna assess CMS. Ma'am, can you push down on my hand?
Patient's unresponsive.
Alright, can you feel which toe I'm touching?
Patient's unresponsive.
Alright, checking radial pulses.
Pulses are weak and present.
Alright, I'm gonna inspect the
The
Left
left
leg.
leg from the knee down to the ankle. You've got some abrasions.
Alright, it is not an immediate life threat, so I'll treat that later. Ma'am, can you push down on my hand?
Patient's unresponsive.
Can you feel which toe I'm touching?
Patient's unresponsive.
Alright, so now I'm gonna inspect the arms.
The left arm, the lower, the forearm, you have severe angulation.
Okay, are pulses intact?
Pulses are weak but present.
Ma'am, can you squeeze my hands?
Patient's unresponsive.
Can you feel which finger I'm touching?
Patient's
Can you
unresponsive.
feel which finger I'm touching?
Patient's unresponsive.
Okay, so at this time we need to inspect the back. So what I'm gonna do is I'm gonna have my partner put his hand on the upper hip and the lower leg, and I'm gonna put my hand on the shoulder and the lower hip, and we're going to log roll the patient on the head's count on a count of 3.
1, 2, 3.
Alright, and so this time I'm not gonna let go of the shoulder, and I'm gonna check the back for any bleeding or any step-ups, any trauma to the back.
Nothing noted.
Alright, at this time I'm going to pull the backboard in, and we're going to lower the patient on heads count.
1, 2, 3.
Alright, and then so we are going to strap the patient to the backboard, starting with the chest, going down to the rest, and then securing the head. I'm going to reassess CMS in all areas.
CMS is weak and present.
All right, ma'am, can you squeeze my hands?
Patient's unresponsive.
All right, and then I'm gonna check CMS down here. Ma'am, can you push on my hands?
Patient's
Patient's
unresponsive.
unresponsive. All right, and then now I'm gonna have my partner start treating the angulation and the abrasion, and then we are going to be a high priority transport to the hospital. I'm gonna reassess vital signs every 5 minutes because they are a trauma. Done.
Done.
What did I forget?